Hey everyone! I wanted to do this video and talk a little about my opinion on the DSM because I just watched a video recently by Vindicated85 and he was talking about changes to the DSM. And it just got me to thinking about the DSM. Now, this isn't the first time I've ever thought about it. I've thought about it a lot in the past. And I have real issues with the DSM. And I know that, it's necessary because psychiatrists, need a baseline to kind of go off of as far as diagnosing people. But that being said, I think the way that certain illnesses are described in the DSM is not always totally accurate, and the problem is that a lot of the things that they say, like I'll just talk about bipolar for example, a lot of the things that they say are just arbitrary. Like, there's no real reason that they chose it, as far as time frames go. Like, I think right now the time frame for a manic period has to be, I think, at least a week. And I think for depression it has to be at least 2 weeks. I think. I could be mistaken. But it's just kind of like, why did they choose that? I mean, is that to say, okay, if you're manic for 5 days, you don't have bipolar, but if you're manic for a week, then you do have bipolar? It's just a randomly chosen time period which doesn't really have any correlation to reality, I guess, to real people's illnesses. And so that bothers me. And also as far as symptomology, they say, okay, you have to have A, B, C, and D symptoms for X amount of time, and that qualifies you for a diagnosis. But say you only have A, B, and C symptoms for Y amount of time, then you don't have an illness. So, I mean, it's bad because not everyone presents with a mental illness, I'm talking about bipolar in particular, in the same way. Anyone who has mental illness knows that. It's very different depending on the person. So, some people have more depressed periods, some people have more manic periods, some people have psychotic symptoms, some people don't. And even within the diagnosis of bipolar, some people may have more problems with being impulsive and, have other symptoms to a lesser degree. Or some people may have more problems with, say, racing thoughts and distractibility, and they may not have the other symptoms to such a great degree. So it's really varied from person to person. And I feel like the DSM kind of excludes people that don't fit into this predetermined box of what they say the illness should be. And I'm not sure how they actually come up with these, definitions of what an illness is, if they just go off of statistics, of what the majority of people experience, or how exactly they come up with these specifics within the diagnosis anyways. But like I say, if you present in a non-typical way, you may not get a diagnosis, and that may prevent you from getting treatment. So that's why I have such a problem with it. And I've had a problem with it personally because I have been misdiagnosed several times. And when I was a teenager, that was my first experience with counseling and psychiatry. And I went in because I was depressed and stuff, and they diagnosed me with an anxiety disorder and started me on antidepressants, which did not do anything for me. They made me feel worse, actually. So that wasn't really helpful. Then when I went into the hospital a couple of years ago with my first manic episode, I was diagnosed as bipolar 2 and started on a mood stabilizer, Lamictal. And I was on Lamictal for about 6 months, and it did nothing for me. It did not stop me from becoming severely depressed. It did not stop me from becoming manic again. It was pretty much a useless drug to me. And then when I started seeing my psychiatrist that I'm seeing now in private practice, she diagnosed me as bipolar 1. And she started me on an antipsychotic, Risperdal, and that really did help me. Within like a week, I was like 90% better. Most of my symptoms had gone away. It really helped me a lot. And I couldn't stay on it because of side effects that I had. But we, experimented with other medications, and she wanted to keep me in that class of antipsychotics because it had worked for me. And so I started taking Zyprexa, and I took Zyprexa for a year, and it was like a miracle drug. I mean, it worked so well. I did not have any symptoms of depression, no symptoms of mania for a whole year. I felt really good. I was doing really well. And then I decided that I wanted to go off my medication, and I did not do so well, and I had another episode, and I went back on the Zyprexa. So I'm on Zyprexa now, and I have been for a few weeks since that episode. And again, within like a week, my moods leveled out. I became stable again. I've been doing really well on it. So it's a problem being misdiagnosed because you may not get the treatment that you need, or it may affect the types of treatment that you get. So when I first started seeing my current psychiatrist, I remember she told me it's not so important the exact diagnosis or the exact label that you have on yourself, whether it's schizoaffective, bipolar 2, bipolar 1, whatever. That's not so important as getting the treatment that you need to alleviate the symptoms that you have. So I agree with that. Like, what I say I have is not as important as getting treated for my symptoms. And I'd say of all the diagnoses that I have gotten, bipolar 1 is the closest to what I experience. Now, I don't necessarily present in a typical way of a bipolar 1 person because, when I have mania, I'm not like super impulsive. I am to a degree, but I mean, I've never gone home with a stranger or put my family in debt or anything like that. But I do have other psychotic type symptoms that tend to go along with my mania, like very disorganized thought processes, bizarre types of behaviors or acting out in a strange manner, paranoia, things like that. So even though I don't technically, according to the DSM, have all these symptoms of mania, I do have symptoms of psychosis. So that would make me closest to bipolar 1, more so than bipolar 2 or an anxiety disorder or, some other kind of disorder. So again, I don't know. I have a problem with the DSM because it's not, people's illnesses are not just like cut and dry. Like, okay, you have all these symptoms for X amount of time and that's the way it is. Like, everyone is different. And to try to lump everyone together, like everyone experiences these symptoms in this particular manner, is not accurate. It's not correct. And, it's really hard, I think, because psychiatry in general, it's still so primitive. Like, they don't know a lot about mental illnesses, about what causes them. Even the treatment, it's like very, it's like a crapshoot basically, because, you know, doctors will say, try this medication, okay, it doesn't work. Try that medication, okay, it doesn't work. It's like trial and error. There's no, you know, empirical way of testing for these illnesses. You can't go have a blood test and say, oh, I have bipolar, or oh, I have schizophrenia. You know, it's very subjective based on who you see at the time and how they interpret your symptoms, which leads to misdiagnoses, like in my case, as I'm sure is the case in many people's lives. I think I read before when I was doing some research that it's an average of 10 years from a time a person enters the mental health system to a time when they get a correct diagnosis. So that just shows how flawed the system really is, that people have to wait 10 years to get a correct diagnosis and correct treatment for their symptoms. So anyways, that's just my 2 cents on the DSM. You know, I'm curious, what do you guys think about it? Do you think it's a good thing? Do you think it has room for improvement? You know, what are your opinions on it? I'm curious to know.